All right. Good afternoon, Southcoast. It's Mike Sylvia, New Bedford Guide, Fall Reporter. Hope everyone's having a safe pre-summer Thursday. We're out of summer coming this weekend, but we want to talk something important, which is vaccines. So my guest right now is the Vice President of Operations for Southcoast Hospital Group, which is Tonya Johnson. She's a RN at Southcoast Health. So welcome to the show.
Thank you. Glad to be here, Mike.
Yeah, so I actually just did an interview with Mayor Mitchell, and something that we always start with was vaccines. So we get kind of his standpoint, or what's kind of the situation. What's kind of your what's the situation of COVID in the South Coast right now?
It's interesting. As we're seeing our vaccination numbers increase, we're definitely seeing the prevalence of COVID decrease. So that's encouraging. It really tells us the vaccines are working, and people need to get vaccinated to continue that trend and that downward trend.
Yeah, I'm going to post, and there was something that just came out, I want to say about an hour and a half ago, which is the city is kind of sponsoring, if you go and get your vaccine, you get a $20 Dunkin' Donut gift card for New Bedford residents. I just posted that in the comments. So the kind of, that used to be, I think it was over 65 or, elderly, and now it's any age at all. So there's not really, there's no reason not to get it, but here's an incentive to go out there and get it. So why is it important? Why should people go get their shots?
Really, honestly, the vaccines are safe, they're effective, we know they work. When you look at kind of complications from COVID-19 and people who have had COVID, I think the Journal of American Medical Association just published an article that notes that individuals who are recovering from COVID, about 75% of them report as onward as 2 to 6 months after recovering from the disease, things like fatigue, kind of a brain fog, where some of the memory functions aren't as good as they were before, or even shortness of breath. What we're seeing with people who are vaccinated is nothing even similar. People have kind of a reaction to the vaccine, maybe some tiredness, some low-grade fever, just general body aches, but that lasts less than 24 hours. And yet, so comparatively, when you look at those side effects, vaccine versus COVID, certainly, vaccination is the answer. It's effective in preventing hospitalization. It's effective, all three vaccines, the Janssen J&J, the Pfizer, and the Moderna vaccines are all effective against hospitalization and, quite frankly, death. And that's, I think, a really important reason. We do see, though, in maybe the younger population that, they're healthy, they're feeling good, and they're like, well, why should I get vaccinated? I already feel great. But unfortunately, we're seeing younger and younger individuals come down with COVID and enter our hospitals and require treatment. And then on the flip side, when you think about concerts and sporting events and all of those types of things, there's been a shift to say, you know what, if you don't want to wear a mask and you want to come to these things, probably vaccination is a good idea, right? Because there may be a point where that is a requirement to enter some of these events that we enjoy, we love, and we miss terribly.
Yeah. Right now, they're actually closing down the main shots on the waterfront in New Bedford, and they're going to go to these smaller clinics. So it's still pretty easy to get your shot, though, right?
Oh, absolutely. In the beginning, it was really hard to get vaccinated, and we had to sort of tier the approach because certainly the demand outpaced the supply. We're sort of on the flip side now. We have plenty of vaccine. We have plenty of availability. You simply can walk in and get vaccinated. No appointment needed, nothing to do in advance. It couldn't be easier. And we're even bringing it to you in some senses by mobile units, pop-up clinics, things that are right in your backyard, your neighborhood.
Yeah, I got my second Moderna shot on Sunday. The next day, it was kind of like the last day of a flu is how I felt, where you're still fatigued for the day, but you're kind of past it. And then after that, it was really good. The first shot, I really didn't get much besides a little bit of a sore shoulder. Didn't really get any other symptoms. So I got vaccinated. The mayor, we both got vaccinated around the same time. So we're kind of like telling people it's something that we're doing, and we're not just kind of pushing it out there. And of course, all the nurses like yourself the healthcare professionals are the bravest, right? So you had to treat people without being vaccinated, and then you're the first ones to get vaccinated, which is like a brand new vaccine, right? So who else better to trust than the nurses?
Yeah, absolutely. And, and the science and the safety behind, developing these vaccines, we hear sometimes, oh, how can they be safe? They were developed so quickly and nothing ever gets approved that quick. But, the US really, and the world, quite frankly, invested a lot of resources and all of the resources and efforts into working on just this, developing a vaccine, because we knew it was the way out of COVID. $12 million, I believe, is what the US invested, so that it wouldn't be a cost prohibitive process. And quite frankly, a lot of scrutiny went into the safety of these vaccines and continues to go into it, reporting side effects and adverse reactions through the vaccine adverse event reporting system that's run by the CDC. So huge confidence in the vaccines. And there was certainly, running to the front of the line, so to speak, from a healthcare provider perspective to get vaccinated, at least across Southcoast.
Yeah, if you have a question, put it in the comments. I'll pull some. And Darren says, what happened to the flu? And I know, I think I know the answer, which is, we did all these precautions, washing hands, wearing masks, all these things to fight COVID, but kind of had a secondary effect against the flu, right?
Yeah, it's interesting. We just ran some graphs and numbers of sort of, the incidence of flu in the past few years compared to this year, and it's almost non-existent. So, a lot more people got flu vaccines. Everybody was wearing a mask, which we know works to prevent the flu as well as COVID. And we basically saw no one with the flu this year. So I think that just speaks to how vaccination and the processes and procedures we put in place to prevent COVID also work against other viruses like the flu.
So what's the numbers for Southcoast Health for vaccine wise? Like how many shots have you given? How many still, I guess, just give me that number, I guess.
Yeah, so to date we've administered just under 95,000 doses of vaccine. And we have about 63% of the individuals we vaccinated fully vaccinated, which means they received either one dose of the Janssen J&J or they received 2 doses of the Moderna or Pfizer at least 2 weeks ago. So the numbers are really moving forward in a way we like to see them.
Yeah, and last week, New Bedford was one of 2 communities that was still considered red, and red means like high-risk communities. I think I talked to the mayor this afternoon. He said we're in yellow. Is that kind of what confirms what you're seeing?
Yeah, certainly. And our numbers, like I said, across the health system are the lowest we've seen, quite frankly, since the beginning of the pandemic.
Yeah, it's amazing because I remember last year, watching all the infection numbers climb, the deaths climb, and now we're really on that like bottom slope right now, which is kind of nice to see. So you brought up the mobile wellness van, and that's something that goes out in the community. And I think I'm looking at 2 dates. So including, you have June 5th at Madeira Field. It's with the club folks that run the Portuguese Feast. And then Friendly Sons of Jack later in June.
Yeah, Friendly Sons of St. Patrick are later on June 10th is our confirmed date.
St. Patrick.
I think it's also an AHA night in New Bedford, so we should see some really good traffic there. Couldn't be easier, right? Come out, have a good time, get your vaccine while you're there, trying to bring the vaccine really to where people are and make it as convenient as possible.
Yeah, I said Friends of Jack because Friends of Jack's one of the great nonprofits that come in and do all the teddy bears and stuff. Yep. But yeah, so Sons of St. Patrick, I believe they do the half marathon and
correct. Yep.
Some of the other things there. So it's a great organization as well. So I guess when I talked to I think it was Dr. Hackner, was that his name? So I was asking him about why it's important. Is there a stage what they call herd immunity that we expect to see this summer, or something? Anything you could answer on that?
Yeah, the number varies by what people are saying kind of is the percentage we're shooting for. The lowest I've seen is about 70% of the population vaccinated. I've also seen kind of quoted at 85%. Really, the bottom line is the more people vaccinated, the better overall, and the less likely our chances of having people come down with COVID and spread it to others.
All right, so that's what we want to talk about, folks. I'm going to give you the last word, though. What do you want to tell us? Anything going on at Southcoast Health, or anything else people should know about?
Just that, we're really committed to making sure that the communities where we live, the communities where we serve are vaccinated, have easy access to vaccines. We've even begun offering vaccinations to those patients that may only be seen in our emergency department, and that may be their only episode or chance to be vaccinated, as well as the inpatients. And we all just need to do our part and, spread the word, have the conversations, and encourage people to get vaccinated, making it as easy as possible.
And I know Southcoast Health, I think you just expanded the emergency department at Toby. Is that correct?
We're in the process of it. It's under construction right now. We had a beam signing
Yep.
just a few days ago. And that was a really great event. But committed to caring for our communities and serving the people that live within them.
Yeah, I don't think people understand the evolution. Like St. Luke's at one time, you couldn't do a lot of the critical, I can't remember what tier they call it, but like gunshots and knives, and you guys upgraded that. You have an expanded room at Toby. So there's a lot more bigger offering of services that people can take care of in the Southcoast hospital groups, right?
Absolutely. I mean, we offer the great services of a big academic medical center, in a neighborhood community right in your backyard. So great access to care right where you live.
Okay, so that was Tonya Johnson. She's the Vice President Operations at Southcoast House Group. Thanks for your time.
Thank you.